First Bliss. This is Trista. Today we have a very special guest. Her name is Dottie Kirkpatrick, and she is a midwife. Hi Dottie, how's it going?
Hi Trista, I'm fine. How are you?
Awesome. Well, you delivered our baby, and you did such an awesome job, and I'd love to share what you know and what you do. So, what is a midwife, and how did it come about? How did midwifery come about?
Well, really, midwifery is as old as women having babies. Midwife means with woman, and we as midwives stay with women through the whole pregnancy and birth and postpartum, supporting them. So actually, our profession is probably one of the oldest professions around, and men actually weren't involved with women's birth until much later, more in the 20th century. That's how old this profession is, and that's how it came about.
So you were saying that men usually aren't involved. So what do they do now, and how do you involve them in the home birth?
Well, what I'm talking about is the doctors. The doctors were the ones that brought birth into the hospital. But midwives were always the ones to be with women in birth for centuries, until more modern times. And the husbands sometimes didn't even really participate as much in the birth, except when there weren't midwives or other women available to help. So now what we do is we want husbands to be the main support person, because of course they're the wife and their baby is the most important role that the patriarch of the family or the father has, is to protect them. So of course they're going to be the main support person, and we're going to assist the dad in supporting his wife so that he can coach her through the labor, he can catch the baby if he wants to, and be as involved in the whole process as the woman is having the baby. That way they bond. They have a much more tight bond with both their wife and their baby after the birth.
Awesome. Yeah, I know he really helped out a lot.
He did.
Yeah, and I felt that he had a bigger bond with the baby.
Yes, Dalton really has.
Other than like other people coming in and interrupting things.
That's right.
What does the midwife do for the 9 months of pregnancy?
So we're only allowed to take low-risk women, and we do all the normal lab work. We check mom's vital signs so that we get a good baseline in pregnancy, so that we know what's normal for her. We check her blood pressure. We do urine checks to make sure she's eating properly. That tells us a lot. We also do checks on the baby, heart rate. We can tell if the baby's growing by checking her fundal height. And we just assist with not only the physical aspects of birth, the physiological aspects of birth, but the mother's social environment, her emotional environment. Everything has an effect on that pregnancy and that baby. And so we schedule hour-long visits so that we can cover all those. And we're also available 24/7. You usually will get a call back the very same day, if not, if you're not able to get a hold of the midwife at that very moment, because especially when you're due, we're right there.
Yeah, it's good to know someone is on call 24/7, especially when a baby can come at any moment.
That's right.
How does a natural birth connect mom to baby?
Well, your body produces hormones and endorphins that help moms to adjust to the increasing intensity of the contractions. And if you're at home, there will be no drugs that interfere with that. And that helps the bonding process also. It just is, the whole environment is just much more conducive to a natural birth, with your body being able to do what it's meant to do, what it was made to do. And by not interfering with that with any kind of drugs or outside environment. Even that can affect how your body responds. We know, for instance, animals will go to a place away from where they feel safe, away from their main area, because they don't want any interference, because they want their body to work naturally. And really, the best place for you to give birth and let your body work its normal process is where you feel safe. If you feel safer in a hospital, then by all means, that's where you should birth. But if you really believe in the home birth model, the midwifery model of care, then your body is going to work best at home.
Awesome. So what are the benefits of having a natural birth?
Your body's able to relax better in your own natural environment. It will produce the hormones and necessary endorphins is one of the things we mentioned, so that you can adjust and cope with each level of pain. You also have, we also provide water birth so that you can relax. We just feel like that is our main source of pain relief, is being able to get in a nice big labor pool that not only relaxes the mom, the warmth of the water is soothing, but the relief from gravity when you're in labor helps you to just let go and let your body do its natural thing, which is open up for the baby in birth.
Awesome. Probably one of the more common question is, how much does a home birth cost, and how much is a midwife?
I'm sure it varies all around the country. I've heard up to $4,000 in some areas, but that is for all the prenatal care, lab work, the birth, the postpartum, and newborn care up to 6 weeks. I charge $2,500 in this area. That's probably close to right in the middle. There are intern midwives who are just beginning their practice, and they do charge less because their experience level is less, and there are some that charge more. I've heard up to $3,500 in our area. I think Denver area midwives go up to $35,000, $36,000, maybe even $4,000, depending on their level of experience.
Awesome. So that's pretty cost friendly for mom and dad.
Yeah.
Awesome.
When they say now a normal vaginal birth in the hospital can be anywhere from $8,000 to $12,000, depending on what procedures you have done, I think that's very cost effective for families. And when you throw into the mix that this is a safe option, and maybe even safer than hospital for low risk women, then this is probably the best that we have to offer in our society.
And of course some insurance will cover that also too, or reimburse you.
Some insurances do, yes. And a lot of us have a billing service that specializes in midwifery reimbursement for midwifery care. So we ask you if you want them to verify benefits. It's very inexpensive, $15, and they'll find out whether your insurance will cover a midwife in your state.
Well, awesome. Thank you, Dottie, so much for your time. You've been awesome, and you have some great information. And
I just wanted to say, I didn't deliver this baby. I just caught her, but Tristan and Dalton together delivered this baby, and that's midwives say we don't do the work. We just make sure that it's a safe environment for mom and baby. And you did fabulous. It was a wonderful experience. I learned a lot in your birth too.
Thank you so much.
Thank you,
Dottie, and tune in next week.